Good afternoon, Dr. Reddy. Good afternoon, Dr. Halappa.
Good
First of
afternoon,
all,
Raman.
thank you so much. Thank you so very much that you have taken time out to join us. And it is a very, very significant moment today for us at CAP TV that we are documenting our journey together. Just about some months ago, we had not even known each other. And from
True.
that day today, I think we have become very dear friends also. We have become wonderful professional associates. And I would like to put it on record the contribution of Indian Railways and through you specifically, sirs, in helping Mysuru in its journey towards TB free. So that is the objective of this interview. And Dr. Reddy, I welcome you. Dr. Reddy is the Chief Medical Superintendent of Mysore Railway Division, Southwestern Railway. बहुत बहुत स्वागत, Dr. Reddy, and welcome to you, Dr. Halappa. Dr. Halappa is the additional Chief Medical Superintendent of Railway Hospital, Mysuru, Southwestern Railway. Thank you so much. Both of you gentlemen have supported so much, so much. So my first question to you, Dr. Reddy, that before we met you and before we explain to you what we are trying to do in Mysuru and about the disease and how your contribution can help, prior to that, what were the activities going on in your hospital and how were you looking at the TB patients? And since then, what has happened? Over to you, sir.
Okay. Thank you, Raman, for inviting us for this discussion. Before this CAP TV project approached us for elimination and control of this dreaded disease, tuberculosis, there was hardly any active programs. Means our involvement was very bare minimum. Only the clinical cases with classical symptoms, only we used to screen. After CAP TB introduced us to this program, there is an active, proactive involvement for screening. All the chronic cases, all the classical symptoms, we collect all the samples and send it for sputum as well as investigation, X-ray and other investigations. So we started getting more cases, and for our this thing, we could pick up many positive cases, and they were put on treatment, which resulting in cure for those patients, and also we prevented the further spread of this disease.
Absolutely, sir. And I would like to acknowledge here that in the past, since October, we have had, in October, we have 11 positive cases. Then in December, we reached to maintain 11. In January, we raised it to 12. In February, we had 16. In March, we had 21. And in April, while we are recording this, we have already reached 15. And we had positive cases in December, 1. In January, we had 2. In March, again, we had 1. So absolutely, all we have done is we just came together. We spoke to each other. All facilities were there. All resources were there. It is just that your focus, it is that you briefed your team and we started looking at, TB also more actively. And we started having these outcomes. So my next question will be to Dr. Halappa. Dr. Halappa, definitely it needs some kind of support from CTI also, from NTEP also, Dr. Mohammed Shiraz. So what are the kind of support that you have been getting from CTI and from the NTEP staff in adapting to this new initiative of screening TB patients at your hospitals?
Yes, sir. Thank you for this one, sir. Sir, this Dr. Siraj has supported us very well, sir. The CET introduced us to the NTP while constantly supporting throughout our journey and also catering the needs in finding the cases. The journey began when we are invited to the TV forum, sir, by CET through Dr. Siraj. CET warmly greeted us at the TV forum, sir, and kept in touch with us. So sensitization workshops were arranged by CET, where Dr. Salil Bhargav who is the Dean of Gandhi Medical College, Bhopal, came down to our hospital, and from Indore, from MP to spread awareness and discuss the technicalities of the program. So we had a nice interaction, and also it helped us to take active participation in this program. So this Dr. Siraj was cooperated very well, sir, and the team also very cooperative in successful implementation of these programs.
Very nice, sir. So I understand that you are recalling the TB forum,
Yes.
which is a very important part of CAP TB project, sir, because that is where we are focusing that we have to strengthen all the health structures which are there supporting the NTP program. You're also recalling the training which was provided, and Dr. Salil Bhargav, who's from CITI, he came down and he also conducted some awareness program. You yourself have conducted so much of awareness within your hospital. I think the NTP staff also came, the STS, the STLS, they have been also coming regularly, and they have been supporting. So, yes. So, and I understand you have incorporated some stamps also, which you are putting on all the patients which are coming into the hospital, sir. Can you tell something about that? How is that helping
Yes,
us?
Yes, sir. We have incorporated one staff regularly for cooperating this program. One Venkateshan, he is the health and family welfare in charge. So, and we have sensitized all the nursing staff also, especially those who are admitted to tuberculosis, and to screen all the cases. So test the sputum examination, do the chest X-ray. So proactively, they are taking interest to find out as well as the diagnose the TB cases.
Thank you, sir. Thank you so much. So now, sir, what happens is we all get busy, in our daily professional life. And, there is always some kind of a firefighting going on, administrative firefighting, professional firefighting, medical cases. Uh, I think CTI has created a WhatsApp group also with you. And I think they don't let you forget about TB. I think, can you recall something, some weekly meetings or some IC material, uh, which is not letting you forget that we are fighting TB also?
True. There is a WhatsApp group, and this group every week, at least once a week, every one of us will be reminded about our activity or our involvement or our caseload. Even if something is missing, they will inform us, and our person who is Mr. Venkatesh, who actively puts up the figures, or if data is required, he will put up to the group for further action. And all the meetings were actually scheduled. It was predetermined as per schedule. It will go on, and without troubling our routine work, as we were busy with other hospital nuances. All the time it was very convenient time only it will be fixed, and the things are going very smoothly without any obstruction, even though this is a part of our work, but it is not disturbing our work.
That is so heartwarming. And, I'm sure when our viewers will see this recording, that you gentlemen are recording for the purpose of larger benefit to the entire country. We want to take this interview to all the districts in the country, wherever railways are, that, how we can come together. So nice of you to say that we had regular meetings, and still we could plan it without disturbing each other's routine, having mutual respect. And you think enough credit has also been given to the railways, to you gentlemen, and to your staff, and to Mr. Venkatesh, enough motivation. What is your view on that?
Yeah, there is a lot of motivation, support, and whenever the first case was picked up, the Mr. Venkatesh, who is the ground level worker, he has been incentivized, and he's so happy. Even other staff are too keen to get involved with this kind of work in our national program. It will
Beautiful.
definitely take us to the heights, and one day we should be able to declare our country is TB free.
Beautiful. This is so wonderful, so heartwarming to know that other people are also willing to join, because this is the height of positivity. So my last question is, since October, what has been, although in the beginning I have recalled, how many presumptives and notification have been done, but I would like to hear it either from Dr. Halappa or from Dr. Reddy, that, what have we achieved since the time we came together?
Since October, we started this program. Nearly about 15 to 16 cases. We are monthly. We are able to test for the presumptive test for the sputum examination, and those who are suspected, no cases will be left out. So each and every case is admitted, as well as in the OPD patient also. We are keen on diagnosing the case if they are having any symptoms. So we are taking care of that from October, almost 12 to 15 cases per month we are screening, sir.
This is such a wonderful support. And my last question to you, Dr. Reddy, we have taken enough of your time.
Yes.
What will be your message to other railway hospitals and other chief medical superintendents? And what has been your experience with CETI? And what is your impression about us?
Yeah, it's really a proud moment for us to get involved in your national program. It's a fantastic program which is designed to eliminate this dreaded disease from the entire nation. I request all the colleagues of railways to get involved in this program to help the team, CT and STP, to eliminate this disease. It is wonderful to interact with you people. I hope everyone should cooperate and get involved actively to help this country to eliminate this disease.
Thank you so much, Dr. Reddy. Thank you so much,
Thank
Dr. Halappa, for your
Thank you.
time. So nice of you. And I'm sure this is going to motivate everyone. And I also wish to, through your medium, thank Mr. Venkatesh, who's the worker on ground from you. His support has been formidable. And without his, active interest, we would not have achieved what we're doing right now. So many, many thanks to you, to Dr. Halappa. Thank you, Dr. Devlina Chatterjee from QIC from CTI. Thank you, Ekta, QIC from CTI. Thank you, Ankita, QIC from CTI. And thank you, Mr. Edwin Rodriguez.
Thank you. Thank you so much.
Thank you, sir. Thank you very much. Thank you very much.